And now it's my pleasure to introduce Mr. David Coyne, who I think is currently, but about to not be, Executive Director of Clinical Innovation and Governance at the Department of Family and Community Services, New South Wales. I'm not sure whether your move has taken effect yet, David. Yes, it has. Okay. Who was up until recently Executive Director of Clinical Innovation and Governance with FACS. So David and his team at ADAC have been key partners with 3DN and have been instrumental in establishing the University Chair in Intellectual Disability Mental Health. And I also know from my experience in health that David and his team have been absolutely critical in forging working relationships between ADAC and health. And David is going to present on a perspective from the disability sector. Thank you.
Thank you, Beth, for the introduction. And it's a delight to be here today. This will be my last occasion where I speak on behalf of the New South Wales Government. And last week marked, not quite, but almost 28 years of service with the New South Wales Government. And it's been a little bit of an emotional time, really, to leave. As Beth said, I am about to go and have yesterday started a new role with the National Disability Insurance Scheme, where I will be responsible for the rollout of the NDIS in much of Sydney. So the great thing for me is that we'll get to continue all of the fun work and the challenging work that we've been progressing together over the last many years. In terms of where some of our thinking and work in ID Mental Health commenced, I'd really like to remind you about how far we've come in our understanding of the intersection of ID and mental illness. Just over 10 years ago, the New South Wales Government recognised the need for a complete transformation in the way that services were delivered through the Stronger Together funding initiatives. It was recognised that the lifespan needs of people with a disability included full participation in all aspects of life, and that all government agencies, and indeed our NGO partners, had a responsibility to meet the needs of people with disability as well as the rest of the community. And that, of course, includes access to mental health services. Workforces across government, and in particular agencies of health and the various human service agencies, undertook to work together to ensure that all people with a disability could receive the support and treatment they needed to live a full and rewarding life. Some of the Stronger Together initiatives are listed there, include the Regional Behaviour Intervention Teams, the Community Justice Program, the Integrated Services Program, Clinical Innovation and Governance, or Office of the Senior Practitioner, as we were initially envisaged, the University Chair in ID Mental Health, and more recently the University Chair in Intellectual Disability and Behaviour Support. I shan't go through all of the programs in great detail because I'll be getting the wind up for time. A couple of highlights though. The Community Justice Program was really a significant reform and program developed several years ago. And it was really in response to evidence-based research that ageing disability and home care recognised that many people with an intellectual disability were falling through the cracks, and that effective disability support would help reduce contact with the justice system. And a number of speakers have already referenced Eileen Baldry's research in relation to the numbers of people with an ID in the criminal justice system who also have episodic periods of mental health support. The Stronger Together initiative enabled the Community Justice Program to be established, as well as the Integrated Services Program, which operates as a combined health, housing and ADAC initiative. In terms of the ISP, and hello Vince, I can see you sitting there. Vince was our director for the ISP, who was really instrumental in establishing the program. The ISP focuses on people who experience coexisting intellectual disability and mental health disorders that have multiple and complex needs and who are at high risk of harm to themselves and others. Along with a number of other operational programs, ADAC recognised the need for an evidence-based and further translational research in New South Wales around the intersection of cognitive disability and mental illness. Interestingly, after 2 evaluations of the ISP, when we look at individuals prior to entry into the program and approximately 18 months after being in the program, there are significant reductions in rates of incarceration, significant reduction in rates of hospitalisation, and very significant reductions in the number of days spent in psychiatric facilities. And that really only underlines the need for such specialist programs in the future. In more contemporary times, there's a lovely shot of the handsome Julian Troller. Clinical innovation and governance at ADAC developed specifications to establish a university chair in intellectual disability and mental health to really spearhead research and to lead the development of support materials for staff working in the field of ID mental health. The chair was established at the University of New South Wales in 2007, with Professor Julian Troller appointed as the world's first chair in ID mental health in 2008. As we've learnt this morning, Julian then went on to establish the Department of Developmental Disability Neuropsychiatry here at the University of New South Wales. Some of the work that's also been critical to better supporting people with an ID mental health has been the work led by many of you here in the room via the ADAC Health Memorandum of Understanding. And there are a number of people in the room who've been instrumental in that. And I do remember a number of meetings with my colleague Beth Kotzer, where we were having robust discussions across the table in relation to definitions, treatment, and occasionally, and less importantly, moving full stops and commas. However, after quite some time, we did actually negotiate a Memorandum of Understanding that was signed in 2010 between ADAC and the Ministry of Health in terms of the provision of services for people with a disability and mental illness. Both departments undertook to work jointly to improve access to mental health services for people with an ID and mental health. In terms of the MOU itself, we established a joint committee in ID mental health, and that committee has met quite religiously for 5 or 6 years, and it has had a role in monitoring and facilitating the implementation of the MOU across the state. And the MOU has created a network of champions from both ADAC and health across both the ADAC regions, but more recently the districts, and the FACS ADAC districts now align with the local health districts, and that certainly assisted in enabling greater collaboration across the state. By way of interest, 4 key KPIs for the MOU are still monitored on a regular basis. They essentially refer to ensuring we have clear client pathways, that there are clear escalation processes, that there are opportunities for joint training across our agencies, and there are opportunities for data sharing in relation to our client cohort. I think I've probably said enough about the ADHC Health MOU. You can see some of the committee members there, and it's very pleasing to see a number of you here today. As part of the joint committee, we also have a children and young persons ID Mental Health advisory group, and David Dossiter has been very instrumental and a strong advocate to ensure that the needs of children and young people in this particular space are not overlooked and are at the forefront of our thinking and planning. Workforce capacity building is clearly a priority in providing support to any sector as disability service provision across Australia prepares for the transition from a state to a Commonwealth jurisdiction. The University and ID Disability Mental Health has worked really quite tirelessly to improve and build workforce capacity of both the health and disability sectors. Julian and his team at 3DN have developed a number of key resources and tools to improve the skills of both individual practitioners and both within disability and mental health that support and treat people with an ID with a mental illness, along with the free online ID mental health training modules for both health and disability staff. The guide for providers to organisations ensure accessible mental health services for people with an ID. We now have the Intellectual Disability Mental Health Core Competency Framework to build the capacity of health staff to work effectively with children and young people and adults. I think I might skip the next slides and really talk about some of the challenges ahead. The next 2 years will highlight how people with an intellectual disability with complex support needs and treatment needs will fare under the NDIS. Increasing the effectiveness of the health sector is crucial as the rollout of the NDIS may struggle to keep pace with the needs of the cohort. The scaffolding of knowledge and skills provided by the university chair to the non-government disability and mental health sectors is invaluable. In concluding, I'd like to say that one of my great challenges from this point on will be to really take all of the learnings with me from the last 10 years plus working in an ID mental health space, ensure that that's understood by my Commonwealth colleagues, but also that it's understood across a growing non-government organisation sector. I'll certainly be advocating in our planning that the needs of people with an ID mental health are first and foremost, that we have good representation of NDIS and NDIA staff across our joint mental health and disability forums, and I look forward to working with you in a new but with a continued focus in the future. Thank you.